First of all, I want to thank everybody for being here today. I'm going to do a speech today in informing you on the stimulant or non-stimulant medication for treating children with ADHD. When my daughter was diagnosed with attention deficit hyperactive disorder, my world went up. I thought, what did I do wrong during my pregnancy? I ate all the right foods. I didn't smoke. I didn't drink alcohol. How could this happen to me? This disorder has no prejudice, but medication can control the symptoms, and a child can focus and stay on task with the right dose of medication. Attention deficit disorder affects up to 5% of all children, and the use of prescription medication to treat it has tripled during the past 2 decades. ADHD has been around a lot longer than most people realize. In fact, a condition that appears to be similar to ADHD was described by Hippocrates, who lived from 460 to 370 BC. The name attention deficit disorder was first introduced in 1980, in the third edition of the Diagnostic and Statistical Manual of Mental Disorders. In 1994, the definition was altered to include 3 groups within ADHD: the predominantly hyperactive impulsive type, the predominantly inattentive type, and the combined type. Recent steps forward in our understanding of ADHD include approximately 2 million children in the U.S. In a classroom of 25 to 30 children, it is likely that at least one will have ADHD. ADHD is the most common mental disorder among children. It is one of the top 4 referrals to a pediatrician, a family doctor, a neurologist, or a child psychiatrist. ADHD is best diagnosed by a child psychologist or other child specialists in ADHD. ADHD is almost 3 times more common in boys than girls. The symptoms of ADHD do not always go away. Up to 60% of child patients retain their symptoms until adulthood. Many adults with ADHD have never been diagnosed, so they may not be aware that they have this disorder or learning disability. ADHD has been identified in every nation and in every culture that it has been studied. So how does a parent know what treatment is best for their child? First, you need a solid diagnosis, particularly since 1 out of 2 children with ADHD has coexisting conditions like depression, a learning disability, or anxiety. Once ADHD is diagnosed, it can be treated with stimulant or non-stimulant medications. The American Academy of Pediatrics recommends stimulant drugs as the primary form of treatment for ADHD. There are 2 main categories of stimulants used to treat ADHD: methylphenidates or amphetamines. The beneficial effects of stimulants can be dramatic. Attention to classwork can improve to the extent that the child is no longer distinguishable from classmates. Activity level can decline to within normal limits, and impulsiveness is not even identified anymore. Activity level can decline to within normal limits and be reduced. Even associated difficulties such as disruptive behavior and peer relationship problems sometimes show dramatic improvement. Interactions between parent and child and between child, his and her siblings have also been shown improvement. Academically, many children show clear improvements in the quantity and quality of work that they complete. As with any medication, stimulant medication used in treating ADHD produces adverse side effects, and in some children. These side effects can include sleep difficulties, stomach aches, headaches, appetite reduction, drowsiness, irritability, nervousness, and excessive staring, among others. In rare cases, stimulant medications can lead to nervous tics, hallucinations, and bizarre behavior. It is unclear which category of stimulants is most effective in treating, and both are commonly used. Methylphenidate drugs include drugs like Ritalin, and amphetamines include Adderall and Vyvanse. Amphetamine stimulants must not be taken by children with pre-existing heart disease. In fact, reports of heart problems and sudden death in patients who took Adderall prompted the U.S. Food and Drug Administration to recommend labeling changes for the drug. If your child's ADHD symptoms don't improve with stimulant medications, non-stimulant medications such as Strattera are another option. They don't perform well as long-acting stimulant drugs, but non-stimulant drugs can be given in the late afternoon or evening without any effects on their appetite or being able to sleep. Non-stimulant drugs are also options for patients who have cardiovascular disease, substance abuse problems, or experience adverse effects from stimulants. The list of possible side effects can be scary to parents considering using medications for their child. But it is important to emphasize that most children with ADHD experience no adverse effects. Based on findings from many carefully controlled studies, physicians have concluded when properly employed, stimulant medication is safe and the side effects are minimal. When side effects do occur, they are frequently short-lived and disappear when the dosage is reduced. Stimulant medications have shown to provide benefits to the majority of children with ADHD. These benefits include reducing core ADHD symptoms, enhancing academic performance, reducing disruptive and aggressive behavior, and improving relationships with their friends and family members. Even though a child may benefit from stimulant medication, there will also be remaining academic and or behavioral difficulties that need to be addressed by other forms of treatment. ADHD is difficult for everyone to deal with, as well as the difficulty of living with the symptoms. Wider society may face challenges. Some experts have linked ADHD with an increased risk of accidents, drug abuse, failure at school, antisocial behavior, and criminal activity. But others view ADHD in a positive light, arguing that it is simply a different method of learning involving greater risk-taking and creativity. Nevertheless, whether you choose to trust your child to treat with stimulant or non-stimulant medication, educate yourself on the pros and cons. Speak with people that are around your child the most, and see what symptoms they see when your child is on medication versus not taking any medication. It is not fair to your child not to use medication to treat their illness, as sometimes they don't understand what is happening to them. As a child, this is not abnormal behavior. Keep trying different strategies and medications until the right medication and dosage is found. Being a parent with a child with ADHD and other mental disorders is very scary, but I have finally found the medication that works for my child. I now drive around with a sticker that says my child is on the A honor roll. Thank you for all coming to my
You're welcome.
informative